Thank you. I'm actually going to continue the story, or the storytelling, but I'm going to start a little bit more recently than 100 years ago. I'm actually starting in 1986, where there was a very important birth, certainly in my field of health promotion, that took place in Ottawa in that year, and it was the birth of the Ottawa Charter. How many of you in the room have heard of the Ottawa Charter? Not many of you. Okay, the Ottawa Charter is actually an international charter, so it came out of Ottawa, but it's actually probably one of the things, the foundation pieces of health promotion as we know it in Canada, and it really underpins the work that I do. The fact that so few of you know about it, I think also speaks to the challenges that I face in my research and many others in health promotion around actually getting attention to something that really has the most impact on our health and well-being. So the Charter actually recognised that health promotion is the domain of social, economic and environmental ministries. So whenever you think about the funding that we have in our system, we really, a lot of what actually dictates whether we are healthy or not is in other things outside of the health domain. And in fact, the ministries of health are really treating illness rather than preventing it. So what the Ottawa Charter actually challenged was that we invest more money in health promotion and that we actually create conditions for healthier populations. And it really held great promise at the time. And one of the things that I think is really important to think about is that the goal of the Ottawa Charter, when it was set out in 1986, was to achieve health for all by the year 2000. My kids were born in the year 2000. They're 18 years old now. Have we got health for all? Did we have health for all back in the year 2000? No, maybe? So the answer is, yeah, resounding no, really. Actually, what we have seen since that time is sickness care spending double over the same time period. And what we have seen is actually investment in health promotion, the very thing that the Ottawa Charter was talking about, has flatlined. Less than 5% of the healthcare budget, sickness care budget really, goes to treating, it goes to population health or health promotion. We've seen our provincial sickness care budget actually consume almost half of the available budget. And what that does is it squeezes out all those other things that we know are important for a civilized society, things like education, for example, housing, having a safe physical environment to actually do the things that we know are important for our health. And chronic diseases and other illnesses are now costing our Canadian economy approximately $190 billion annually, and account for around 58% of those annual sickness care spending that we have. So the Ottawa Charter, 33 years old now, so middle-aged maybe, is still very, very relevant to the way that we fund sickness care and the way that we actually live our lives. We've just heard from Shashi about cancer, something that's very close to my heart. I've already had it. I will likely get it again. And actually 1 in 2 of us in this room and elsewhere, 1 in 2 of us will develop cancer in our lifetime. That's the way it is, unfortunately. But did you know that 40% of all cancer cases could be prevented? That's huge. And the way that we can prevent it is by eating healthy, being active, living smoke-free. More behaviours than that, but those are the 3 I'm going to focus on today. We also know that heart disease and stroke is likely to kill many of us. About 80% of our hospitalizations are for that. But we could, a large number of our hospitalizations are for that, but 80% of heart disease and stroke could be prevented. Do you know what by? Healthy eating, being active, living smoke-free. Same risk factors for cancer, also shared by heart disease and stroke. Same things that we could all be doing better in terms of our behaviours. Yet, when we actually look at who is eating healthy, being active, and living smoke-free, it's a bit of a depressing picture. Fewer than 5% of us are actually able to achieve all the behaviours at the same time that we would need to be healthy. That's, again, another thing that I spend a lot of my time worrying about. Because essentially, what this means is that healthy behaviour, healthy eating, being active, living smoke-free, is abnormal. It's abnormal behaviour. Think about that for a minute. And our modern environment is actually encouraging that. It's encouraging us to do the opposite behaviours of the things that we should be doing to prevent our risk of chronic disease and to actually achieve our best health potential. And we can't keep putting money into the system to fix those problems when they've started. We have to invest in prevention, and that's what I spend my time doing. We can't keep ignoring what we heard from the Ottawa Charter 33 years ago. And so where better to start that behaviour change than in schools, and that's where I focus on primarily now. Schools are an important setting because they actually provide a protected space, somewhere our kids can learn and understand about healthy eating, being active, living smoke-free, in an environment that's actually very supportive. And we also know that if we were to support the health and learning of our children and youth, that it has a stunning return on investment. Those of you who play the stock market, I think, would probably be really happy with a $13 return on investment for every dollar that you invest. That's what we get when we actually help kids to achieve their health and learning potential in schools. And here in Nova Scotia, we're actually the perfect social laboratory for that kind of work to happen, because we're small enough, but we've also got a population that is big enough to test these things out and actually scale them up. And in fact, Nova Scotia has been a leader in many of these things that we're talking about here in the school system. Nova Scotia has implemented health promoting schools model in the school system for a number of years. But unfortunately, what my research has found is that we're not implementing those principles at the dose required for the changes that we want to see. So there are some school communities that do this really, really well, and there are some school communities where they do it less well, if not poorly. So what we're really looking at with the work that I'm doing is actually trying to get the dose of change required. And that requires what we call systems change. So I'm not trying to influence individual behavior as much as I'm trying to influence the behavior of the system, so that the systems actually work together to improve the health and learning of children. And so when I talk about this, I'm really talking about something that we've known for decades, but it's not actually happening, and it's why it's not happening that I'm really interested in changing. So my colleague, Camille Hancock-Friesen, she's a cardiac surgeon who currently works in Texas, but when I knew her, she was in Nova Scotia. Camille and I got together because she was really seeing the challenges that our children face. She operating on kids who are actually showing the first signs of heart disease in childhood. And we now see diseases of adulthood. I learnt about maturity onset diabetes when I was in my training, because we didn't ever see type 2 diabetes in anybody under 40. And now we see diagnosis of type 2 diabetes in children, and increasing numbers year in, year out. We now know that our children actually probably could have a shorter life expectancy than their parents. And I think that's, again, a very problematic thing to be dealing with. And so Camille and I got together because we really wanted to sort of see about making change. And we worked within the school system to make that change through a program called Heart Healthy Kids. And what we did with that is we actually trained the students themselves to be the change agents within that school, their school community, to be the ones who led physical activity and healthy eating initiatives within the school system. And what that then really planted the seeds for what then became Uplift, which is where we are today with the funding that we just received from the Public Health Agency of Canada. As Janet noted, we're the first people in Nova Scotia to actually leverage that funding. And we owe a huge debt of gratitude to the Dalhousie Medical Research Foundation, the QE2 Foundation, the IWK Foundation, and Dalhousie Advancement for coming together for the first time as well to actually help fundraise for us to get the matching private sector funds that we want and need to leverage that funding. Moving forward, we're actually going to be in the school systems in September. In fact, I just came from a meeting to come here today with our key partners who are all really working together to help move this forward and to really create healthier generations for the children and youth of this province. Thank you.